Chapter 19, the urinary system. So your kidneys are the main organ of your urinary system, and they lie just underneath your back muscles behind your parietal peritoneum, just above your waistline. So just a couple inches above where the top of your pelvis is, are where your kidneys are. And normally your right kidney is just a little bit lower than your left kidney. So you can see that here. So here are your kidneys. You can see where your left kidney is just a little bit higher, and this shows where your pelvis ends, or the top part of your pelvis, and that your kidneys are just a little bit above there. This also shows that there's your major blood vessels drain very close to your kidneys, and that's because they use your kidneys as a filtration system. That's just a picture of the kidney close-up so that you can see a little bit of the internal structure. So what is the function of the kidney? Well, the kidney is used to excrete toxins and nitrogenous waste from your blood. It just filters them out of your blood and then works to excrete them. It also regulates the levels of many chemicals in your blood and helps to maintain the water balance because it will excrete that extra fluid and if you have too much, and hold on to it more if you don't have enough. For the same reasons as that, it's also how it maintains your blood pressure. If your blood pressure gets low or your blood volume is low, it holds on to more fluid to allow you to have more re-enter your circulatory system. If your blood pressure is high, you can actually start to pee off more liquid to help lower that blood volume and decrease your blood pressure. It also helps to regulate your red blood cell production by secreting something called erythropoietin, which we'll talk about a little bit more later. So the formation of urine. So the filtration in the kidney goes on continuously, and that happens in the renal corpuscles, which we won't really talk too much about the microstructure of the kidney. I don't think it's overly helpful for you. I just want you to know the basics. What does the kidney do? So the blood pressure basically just causes the water to dissolve the substrates, and then it filters through the kidney. So the kidneys are really just like this whole giant filtration system. So the blood pressure as it goes through your kidneys helps to dissolve some substances while holding on to others. So the ones that it dissolves can actually be excreted out of your body, but there are some of them that it holds onto to then place back into circulation. So that the ones that it holds onto that it puts back into circulation, that's called reabsorption. And that's the movement of substances out of your renal tubules. Those are the little like vessels kind of in your kidneys. And they go back into the blood by the capillaries that are located throughout your kidneys. And the things that are reabsorbed are things like water and nutrients and certain ions, which are things like sodium and potassium. They can sometimes carry a charge, and that's what makes them ions, but those, as your body needs, can be reabsorbed. And then water is reabsorbed via osmosis. So what that means is that there are more molecules on one side of the membrane than the other, and so water tries to balance it out. It wants the same amount of water per molecule concentration on both sides of the membrane. So your kidney then also works for secretion, and that's because the movement of substances into your urine and then into the collecting ducts is secretion. So the hydrogen ions and your potassium ions and then certain other drugs are secreted by this kind of active transport. Active transport means that your body's actually having to work to make it happen. It takes energy to make it happen. Diffusion is considered a passive transport, so ammonia is secreted by diffusion. That means that it's trying to like maintain the balance. So sort of like how osmosis happens, where it's naturally automatically trying to maintain that balance of fluid molecules per like solid molecules on both sides of the membrane. So that's passive because it's just trying to balance it out. Ammonia is the same way. It's diffusing to an area of lower concentration, where things like the ions are actually active. Your body has to use energy to get rid of them, to put them where they want them to go. So here's just a picture in case you're a visual learner to help you think about it. It's color coded. So you can see like here is part of your kidney, so the fluid's leaving out of it, and so it's reabsorbing some of this fluid and some of the sodium. It's reabsorbing the glucose, but then it's also taking in some of these things to then be excreted, like your NH3. But it's reabsorbing, like your that's your potassium and some more water. It's going to excrete some extra hydrogen ions. So those are your hydrogen ions are actually what makes it so acidic. That's just a picture in case you're a visual learner. So the formation of urine. The control of urine volume is controlled by a few hormones. We have ADH. ADH stands for anti-diuretic hormone. I think we mentioned this briefly earlier. So anti means it doesn't happen. Diuretic is something that makes you pee. So if it's an anti-diuretic, it's basically telling you not to pee. And that's secreted by your posterior pituitary gland, and that promotes the water to be reabsorbed in your kidney, so it reduces your urine volume. Then you have aldosterone. Aldosterone is secreted by your adrenal glands, and that's triggered by your RAAS process. I'm not going to ask you to know what that means. And that promotes sodium and water reabsorption. So that also is going to reduce your urine volume because it's telling your body to reabsorb that sodium and water. And then you have ANH. ANH is just another peptide hormone that's secreted by your atrial cells in your heart, and that promotes the loss of sodium and water. So that increases your blood volume. And what that hormone does is it senses the amount of stretch in your atrial cells, and if they're being stretched too far, it's going to tell your kidney, I have too much volume, secrete more. So antidiuretic hormone reduces urinary volume. Aldosterone reduces urinary volume. ANH increases urinary volume. And there's just a picture of the kind of a flow chart here, I guess. So if you have a normal plasma volume versus a low plasma volume, and some of the things that it triggers. So this is how your angiotensin and your aldosterone system will work. So for your ureters, the structure of them is just that they're very long tubes, and they expand to the upper end of your renal pelvis, and they're located inside your kidney. They're lined with a very mucous membrane because these things do have an opening to the outside at the end, well, opening to your bladder and then to the outside, and they have a good muscular layer. So what is their function? Their function is to drain urine from your renal pelvis down to your urinary bladder. And that's because it goes down there so that it can eventually be excreted. So just as a side note here, a urinalysis. A urinalysis is a medical test that's done that examines the physical, chemical, and microscopic characteristics of urine. So that's basically when we're going to take a urine sample and look at it. Both how does it look and how does it look on a close-up look, on a microscopic level, what are the chemical components, and that just helps us determine the presence and nature of any pathological conditions. So that'll be like, is there glucose in there? How much sodium are you secreting? Do we find any bacteria? What's the acidity? Just like that kind of stuff, because it'll help us determine if there's something wrong with your kidneys or with your bladder or with some part of your urinary system, if we can find something in a urinalysis. So urinary bladder, since we were just mentioning it. So the structure of your urinary bladder, it's really just a very large, elastic, muscular organ that's capable of great expansion. As any of you have known, if you've tried to hold it for a long trip or something, it's lined with a mucous membrane, and it has your mucous membrane forms rugae, which are kind of like in your stomach as well, if you can remember back to your digestive system, and they're sort of like these big ridges, and they just allow for a lot of expansion, because when your bladder expands, they sort of flatten out, but then when it shrinks back, they shrivel up. And what are the functions of your bladder? It basically functions just to store your urine before you void, and then it helps you void because it's very muscular, so it helps provide that squeeze. And that's just a picture of your bladder, and you can see where your ureters, one from each kidney, drain down into it. And then this is where your urine would be excreted out. It's your prostate gland. Your prostate gland's a big donut wrapped around your urethra. So your urethra. Your urethra is a narrow tube that extends from the urinary bladder down into the exterior, also lined with a mucous membrane. And the opening of your urethra is to the exterior is called your urinary meatus. So what are its functions? Well, it's a passageway for urine to go from your bladder to the exterior so it can be excreted from your body. And if you're a male, it also is a passageway for your reproductive fluids. So, the passage of urine from your body, which is also called urination or voiding. It is controlled, at least in part, by a couple of regulatory sphincters that you have, and you have an internal one and an external one. Your internal one is located kind of right at the very bottom of your bladder, and that one is involuntary. We can't really control when it opens or not, and that's when there's enough pressure on it. That's when it wants to open. Where your external your external sphincter, that's the one kind of closer down towards the end of your or closer down by your meatus, that one's voluntary. So that's the one that we have control over. So that's what we open up when we go to void. So your bladder wall really permits a lot of storage space without a ton of increase in pressure because of how much it can expand. And when the pressure reaches a certain amount, that's when your involuntary sphincter wants to open up because the pressure is higher inside than outside. So that would be your emptying reflex. It's initiated by that stretch of the bladder wall, and it triggers the bladder to want to contract, which then your internal sphincter relaxes. And finally, when you want it to, because your external sphincter we have control over, you'll relax that sphincter and urination occurs. Enuresis is the involuntary urination of a young child, and it's called that because they don't have good control of that external sphincter yet. So urinary retention. Urinary retention is when there's urine produced, but it's not voided. Urinary suppression is when there's no urine produced, but everything in the bladder is functioning fine and normally. So retention, you're making it, but you can't get it out. Suppression, you're not making it, but you could get it out if you did make urine. Incontinence. So incontinence is when urine is voided involuntarily. There are a few different kinds of incontinence. There's urge incontinence, and that is associated with like an overactivity or involuntary muscle contractions that all of a sudden make you go. There's stress incontinence, and that's normally associated just with a very weak pelvic floor. So under normal conditions, you can manage to keep that external sphincter closed, but when there's some sort of stress inside your body, you can't anymore. So this normally happens when somebody coughs or sneezes or sometimes laughs. That can trigger stress incontinence. There's overflow incontinence, and that's normally associated with urinary retention, and they just overextend their bladder to the amount where because they can't really urinate when they want to, that it just sort of triggers everything to open up, and it's like suddenly the floodgates open and it comes everywhere. And then there's reflex incontinence, and that's when there's an absence of any sensory warning or awareness. So this normally happens in stroke or spinal cord injury patients, where it's just your body kind of triggers that reflex to go and you just don't know what's coming, so you can't control it. And then there's a neurogenic bladder, and that's when there's a periodic but it's unpredictable voiding, and that's normally related to some sort of paralysis or abnormal function of the bladder. So you're not paralyzed necessarily your whole body, but there's some sort of abnormal sensation in your bladder. So your bladder just kind of releases normally kind of on a regular filling cycle, depending on how distended it gets, but it's hard to predict because it's not like on a regular schedule and you can't control it. So for a few other renal and urinary disorders, you can have an obstructive disorder, and that normally it interferes with normal urinary flow. So that can cause urine to back up into your bladder or into your kidneys, and that can actually cause kidney damage or hydronephrosis. So a couple of things that can happen to your kidney are you can have renal calculi, which are also known as kidney stones, and they can actually block your ureter, which can cause an incredible intense pain. If you ever know anybody who's had kidney stones, they'll say that it was horrible and intense pain. You can actually start to develop, or another thing that might block it would be a tumor. You can have a renal cell carcinoma, remember carcinoma is tumor, or a bladder cancer. And a lot of the time, one of the first signs that you see there is actually hematuria. Hematuria just means that there's blood in the urine. And then there's hydronephrosis. So hydronephrosis is when there's an enlargement of the renal pelvis, so just an enlargement of your kidneys, and that's actually caused by urine building up in there. So it's just kind of like blowing them up like a balloon because there's too much fluid that's backing up into them. You can also have urinary tract infections, or UTIs. Probably most people are well aware of these. And these are normally caused by a gram-negative bacteria. So who remembers way back to, I believe it was chapter 5, when we talked about negative versus positive. So it was had to do with it taking color dye, but it's just a type of classification of bacteria. So you can have a urethritis, which is when you have an inflammation or an infection of your urethra. There's cystitis, and that's when the inflammation or infection is of your bladder. Polynephritis is when the inflammation or infection is in your renal pelvis or in the connective tissues of your kidneys, and that could be acute, which is normally infectious, so the inflammation is infectious, or it could be an autoimmune disorder that's causing that inflammation because your body's kind of almost attacking your kidneys themselves. Or then hydronephrosis, which is what we talked about in the last slide as well, which is an enlargement of your renal pelvis or of your kidneys. So you can have also some glomerular disorders, and that can be a result from damage to your glomerular capsular membrane in your renal. So I know a whole bunch of big technical words there. These are just your glomerular capsules are inside your kidney, and those are where everything's filtered. So these are some saying that damage can actually happen to those in particular. So you can have nephrotic syndrome, and that can accompany a lot of these glomerular disorders. So those are things like proteinuria, and that's when you have protein in your urine. You can have hypoalbuminemia, which is when you have a low plasma protein albumin, and that's caused by the loss of proteins to urine. So that's when your plasma protein level is really low, and that's sometimes because you have proteinuria. So because you're losing it in your urine, there's not very much in your blood because it's being filtered out of your blood and excreted out of your body. Another sign would be edema. So edema is when you have tissue swelling, and normally that's when water has left your vasculature, so your vessels, and is now just kind of sitting in between your cells. And one reason why that happens is actually that low albumin level, so that low plasma protein level. And that's because water normally does the osmosis thing, and it wants to have the same number of molecules dissolved in it on both sides of the membrane. So if we take out a lot of protein, then there's less stuff in our vasculature, but there's not less stuff in our cells around our vasculature. So some water is going to leave our vessels and go out into the cells to try to balance it out, and that creates edema. So you can have acute glomerular nephritis, which is one of these glomerular disorders, and that's caused by a delayed immune response. So like a stress infection can actually trigger this immune response that causes this acute case of glomerular nephritis. Or you could have a chronic version of it, which is a very slow inflammatory condition, and that's when you have an immune mechanism that's kind of slowly attacking your kidneys, and that oftentimes leads to renal failure. So, renal failure. What is renal failure? So that occurs when your kidney fails to function. So you can have either acute or chronic renal failure. Acute is when it's an abrupt reduction in how your kidney functions, and that's normally very reversible. Chronic kidney failure, on the other hand, is very slow and it's very progressive. So it's this very progressive loss of kidney function, oftentimes due to some other underlying disease. So one of these diseases, just for an example, is polycystic kidney disease. So that's when you have numerous fluid-filled cysts that actually destroy your kidney tissue as they grow, and that can be hereditary. So that is a picture of somebody who has polycystic disease. So this is a kidney that has, look at how many cysts that is, but look how small amount of actually functioning kidney tissue they have left because of the number of cysts they have developed. So you can definitely understand why this would severely limit how much blood your kidneys could filter. So some stages of kidney failure. We stage kidney failure just to give an idea of how well somebody's kidneys are still functioning. So even though you might have kidney failure, there might be very little damage and we really don't need to do very much. We might have very severe kidney damage, which means that we have to do a lot. So progression of kidney failure. First, there's stage 1. Stage 1 is very early in the disease process. Most of the kidney cells are still functional and healthy, and they can compensate for the few that are damaged or lost. Stage 2, this is normally called renal insufficiency, and this means that you still have functioning kidney cells, but not enough to fully compensate. So now there are some life-threatening consequences if you don't really make sure that you're taking care of yourself and that you're aware of it and know what your body needs. And this is because you are going to have some altered blood levels of things. You're not going to excrete everything that you need to normally. And these are the people that get very sick very quickly when it comes to kidney disease. And then finally, stage 3. So stage 3 is complete kidney failure. And at this stage, their kidneys are no longer functioning, which means that they have a few options, but they can't go without treating their kidney failure, because your kidneys are vital for existence. They're vital to maintain homeostasis, which is necessary for life. So basically their options are that either they get a kidney transplant, they start going for dialysis, which is what they say is an artificial kidney here. Dialysis is an external filtration machine where they actually take an IV in and take an IV out of your body, and they take your blood out and filter it through like a fake kidney and then put it back into you. Normally people that are in this stage 3 end up getting dialysis like 3 days a week because they don't have a kidney that works themselves. So they need they need this machine to filter out that extra fluid and those waste products for them. So your options are really, you get a kidney transplant, you go for dialysis 3 days a week, or you die, which is sad and probably a little brutal for me to say that, but if you get to that point where you just don't have any functioning kidney cells anymore, you have to do something else to compensate for it. So that brings us to the end of the urinary chapter.